So today we're going to visit one of my 78-year-old patients who lives in Redfern. He's in one of the tower blocks and he's got multiple chronic and complex diseases and a complicated sort of social setup and history. He's got diabetes, he's got chronic leg ulcers, he's got a nasty foot ulcer from walking on it a fair bit up to the community health centre for his dressings. So we'll go and see him now.
So David first came to us at the Diabetes Centre because he had a foot at risk of amputation. And when the staff treated David, they recognised that his social situation was such that he probably wouldn't heal in the current situation. So we were able to call on James and his team. And I have to say, they are miracle workers. Not only do they mostly improve the person's quality of life, they also set up the situation and the environment so that the clinical outcomes improve. And that's exactly what happened with David.
So when David was referred to us, we actually couldn't get in. There was items hoarded and stocked up all the way to the door, so we couldn't get in. So we went with our Housing New South Wales partners, and he did let us in. And we realised that there was a lot of limitations to what care could be provided in his house. He was sleeping in a chair overnight. He couldn't access his bedroom anymore. There was a very small little hallway that he could get to that chair, so he wasn't elevating his legs. Fluid was building up in the lower limbs, and that was exacerbating his leg ulcers and his foot ulcer. Hey David, just James checking in on you.
Yeah.
Seeing how you're going.
All right.
Good. Yeah, will I come in?
Yes.
Great, thanks.
The Chronic and Complex Care Program is an essential program that sort of fills the gaps between everything that's available out there in the community. There's a lot of services available for older people, but there's very little coordination, and the Complex Care Program fills that gap perfectly.
Bringing James Courtney into that, we've allowed a foot into the door who's identified the hoarding, able to keep appointments, times, medication, compliance, and bring that all together where now we believe there's more as a safe net for David in the community, that he can live in the community now safely.
So when David was discharged from Balmain Hospital, he had agreed part of his goals were to get a massive clean done in his apartment. He knew his tenancy was potentially at risk and his health was at risk because of the environment in his apartment. So the social worker and us worked with David to set some goals which he agreed to, and he worked with the Salvation Army cleaners then to set the goals of what he wanted removed from his apartment. During that time, he went into some residential respite.
James was able to, through great sort of persistence, get in with David into his home, help sort out things, make his life much more acceptable, and that translated into improving David's legs. So David actually now has been discharged from our clinic because with the help of James, we've been able to cure the problem that he had.
So David's a lot healthier, happier and safer in his tenancy now. His medications are in a Webster pack which he either collects weekly or his care providers. He's giving himself his insulin daily, he's eating better, he's accessing the community with his aged care package providers, so he's getting to his GP and other medical appointments like high-risk foot clinic as needed. So he's a lot healthier, safer and happier, and his tenancy is secured. The point of difference with this program is that we work with our patients to set their own health goals. With those goals, we then empower them to look at solutions to their care needs, and then we work with them to implement those care options. And they have to be long-term sustainable options that keep people safer and healthier and happier in their own home.